We will talk about Chlamydia trachomatis. It's sexually transmitted infection, which is very common disease, and it has serious complications. That's why it's important to treat and identify this condition. And complication can be infertility also. It's in many cases is asymptomatic, meaning no symptoms at all. Almost 80% of cases of women and 50% of men cases no symptoms at all. And when symptoms occur, they are mild, like genital discharge and mild abdominal pain and burning sensation during urination. And if this symptom complex will occur, like genital discharge and plus burning sensation during urination, in many cases is chlamydia infection. Other several infections also cause this complex of symptoms like genital discharge plus burning sensation, but it's more common and more specific for chlamydia. But it also can be gonorrhea and it can be yeast infection in case of women also. And why it's important, what complications we have. Serious complication in women is pelvic inflammatory disease and infertility. These complications will develop within months. First stage is very mild and no symptoms at all. In second stage, some symptoms develop like genital discharge and burning sensation, and third stage of the disease already is complications, and several months is required, sometimes several weeks, to develop these complications. For men, it can be epididymitis also. And this infection can spread into body's other part also, like eye infection, which is called trachoma. But eye infection is more common in newborns when they get this chlamydia infection from their mother during childbirth. And sometimes this infection spread to lymphatic system, and it is called lymphogranuloma venereum. And chlamydia increases risk of ectopic pregnancy 4 times. It's very important because if we have ectopic pregnancy, there is high probability that there is infection also. And chlamydia represents one of the most common sexually transmitted disease. It affects around 2% of world population. Sometimes it is thought that it's most common sexually transmitted disease, but it's possible that papillomavirus is more common, and identified cases are much more common. Transmission is unprotected sexual intercourse or during childbirth. This is two most common way of transmission, and that's why CDC recommends screen everyone who is sexually active under the 25, especially for women. The standard of diagnosis is nucleic acid amplification test. It is get from urine sample or genital swab, and antibody testing and linked immunosorbent assay or ELISA is also common type of testing, which is more cheaper way, but it's less sensitive. And treatment is antibiotics. We have very high cure rate, more than 95%. And azithromycin is first line drug. It can be single dose enough for cure, and doxycycline also for 7 days. And second line treatment is erythromycin. But main limitation of treatment is reinfection, because person can get this infection anytime, even if he or she is treated already. That's all I wanted to say about chlamydia. It's important to know and screen for chlamydia regularly, especially who is active and especially people with multiple sexual partners. For them, they are high risk group, so they need to screen regularly. Thank you for your interest. Thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.